Hi, friends. I'd like to address a topic with you, which is the idea that therapy can be done in one session. So, before we can even begin this discussion, let, let us establish what it is that we're talking about. So, there's a difference between relieving a symptom versus profound healing. Let's start with that differentiation. So when we say, can it be done in one session? I think we have to define what we're talking about. Are we talking about removing a symptom, or are we talking about a profound healing? So let me explain what I mean by that. I have done this on many, many occasions. At different parties or gathering, a person will have something like a toothache. This happened just a few weeks ago. I was at a gathering and there was a man there who was visibly uncomfortable. I asked him what was wrong. He says that his tooth was hurting. So we offered to hypnotize him. He goes into hypnosis. A few suggestions later, he says that he's feeling much better and he proceeds to go dance and enjoy the rest of the evening. Now, of course, part of the suggestion was come Monday morning, first thing you're going to do is call your dentist and go take care of this because evidently, if the tooth is hurting, there's some sort of problem in there. All we have done is use his own mind as an analgesic. In other words, as a pain killer of some type. And the mind does have the opportunity, does have the capability to remove pain. Any sports person, any athlete can tell you that sometimes we're in the middle of a game or you're in an important race and you might even pull a muscle or dislocate a shoulder in some cases. And if the game is hot enough, you keep on playing, and only hours later in the locker room when you're cooling off is when you realize that you've sustained an injury. So this is evidence of the fact that the mind can mask pain. Now that does not mean that there is no injury, that there's no problem there, such as in the case of the toothache. The tooth was in some way compromised, and it had to be addressed at a dental level by a dentist. It isn't hypnosis is not going to put the filling back in, or is not going to take care of the nerve damage or whatever the case might be in his tooth. So that type of thing is what we call symptomatic relief. A person has a symptom, has a discomfort, we can hypnotize the person, and this happened over the course of a few minutes in the middle of a ballroom where people are dancing and screaming and talking, and I have done this on multiple occasions. Another example of a symptom is a lady who once at a conference in a hotel had lost her purse. So this is a symptom. This is not profound healing. This is a symptom. She lost her purse. So it was a little weird because I'm in a room with probably 50 other hypnotists, and I'm thinking, I'm the junior guy in the room. Surely somebody's going to offer to hypnotize her. She herself was a hypnotist, but she was desperate because she had lost her purse. Well, since nobody else was offering, I did. I offered to hypnotize her, and I asked her to, that in about 3 minutes, she would be remembering where she left the purse. And sure enough, about 10 minutes later, she walks back into the room, purse in hand, ecstatically happy, saying, okay, I remembered where I left my purse, which is, the removal of a symptom. The symptom in this case was the pain of having lost her purse. That symptom was alleviated by, in fact, finding the purse. And both of these examples I just gave you and others of such types, of course, only require one sitting or one session or one event. So we call this symptomatic relief. And it can, of course, be done in a few minutes, in some cases, very few minutes, in some cases, a few more minutes, but again, it's one session. Now, compare that, for instance, to the person who feels a profound sense of void in his life. Now, notice how abstract this definition is. What symptom is that? I feel this profound void in my life. I don't feel satisfied. I don't feel happy. I don't feel fulfilled by life. I have questions about the existence of God. I don't know if I'm a worthwhile human being. Now, I'm making up these types of quests by therapeutic clients to illustrate the fact that it can become very abstract and very difficult to track and manage, even at a therapeutic level. We do this all the time here at the office, but what I'm saying is it's not trivial. Take, for instance, a marital strife, a marital problem. We say here in our office, there are no marital problems. There are individual problems that affect a marriage or a relationship of some type. And tracking what are those individual problems and helping the person heal them, fundamentally heal them, so that the character of the relationship changes, that is not a trivial thing and it's not one event. So profound healing always involves a complete transformation of the person from one type of person onto another. The example that I often give in class is, of course, that of puberty. When you go through puberty, we are not the same person anymore. In other words, if you look at yourself 1 year prior to the onset of puberty, and let's say a couple of years after the onset of puberty, you're not the same person anymore. You don't talk the same way, you don't have the same interests, you don't dress the same way. In other words, your life has changed quite a bit. We all, I mean, any adult, healthy adult, I guess, has been through that process and knows exactly what I'm talking about. And this is an example of transformation. It isn't just a little symptom that's going to go away, puberty, I'm saying. It is a profound transformation in our lives, and it's a one-way street. We don't really go backwards. I mean, once you hit puberty, you kind of go in one direction and your life changes forever, basically. So the same thing happens with therapeutic transformation, or healing, as I call it, as opposed to symptomatic relief. And those kinds of healings are not possible in one session. Those types of things take a little bit of time because it's not trivial. It's not a superficial thing. It's not trivial. Now, let me address this from a different angle here for a second. I was at a gym once, and a lady dislocated her shoulder. See, so once again, I want to emphasize that therapy is any kind of intervention that is intentionally produced in order to help the person become or be better, right? So this woman in the middle of the gym dislocates her shoulder. I think she was lifting too much weight or something, but she started screaming in pain. Her arm looked like it was like broken. It looked a little, of course, to the untrained eye, it looked like a little, it didn't look pretty, right? But there was a man in there who was a medic, a trained professional medic. And this man didn't think twice. He held her down with another coach that was there, and they popped her shoulder back in place. And of course, she screamed quite a bit, but apparently they knew what they were doing, and they fixed it, right? So if you think of that procedure, the manipulation of her arm, as therapy, because it's a therapeutic intervention. It took a few minutes only. And that was the end of it. Of course, not the end of her pain. It was the end of it in the sense that she left the gym. I later found out she took some painkillers for a couple of weeks. It took about 6 weeks to recover her shoulders, but no more intervention. The shoulder was already back in place. Now the whole area was very sore, and she couldn't lift weights. But this is what I found out later from her. But there's really no other intervention needed, or at least she didn't seek any other type of intervention. So if we look at that as what really happened there from a therapeutic perspective, the whole intervention took only a few minutes. Now compare that to the old style of psychoanalysis, where it was common for a person to be in therapy for upwards of 10 years. 10 years, 18 years was very common back in the first part of the 20th century, because we were delving one layer at a time into the inner depths of the unconscious, and the process was confounded by the very mind's opposition or resistance to its own self-revelation, and as a result, the process took a while. And patients often went to therapy a couple of times a week for many, many, many years, and this was normal, this was expected. So techniques have evolved, and today I don't think it's very common for a person to go into therapy. I guess it depends on the type of condition that the person has. If they have a more organic mental sort of problem, they might need lifelong therapy in some cases. But for the average person who's just looking to change something about themselves, I believe we're now, the industry standard is shorter interventions than 18 years, but it isn't one event, it isn't one session. So I just want to emphasize this to you. And the reason why I think this is important is that we get calls here and people tell us, well, I called another hypnotist and they promised that they can do this in one session. And I say, well, we got to compare apples to apples here. First of all, I have no attachment to the result. I'm not trying to sell you anything. I'm not trying to convince you of anything. I'm just trying to help you out and explain that, before you go comparing services, make sure that you're comparing apples to apples. Because again, in the examples that I provided to you, it's radically different to help a person relieve a symptom as it is to achieve deeper healing. Now, In our office here, I've been doing this for 21 years as of the publication of this video, and we emphasize profound healings. So people come here, they value that sort of service. Not everybody can do that. We've been doing this for a long time. It is very meticulous work, very, very delicate work. It's not trivial, it's not easy for both of us. And it does take a lot of attention, a lot of care. And this is just where we've found ourselves specializing in over the years. So if you're looking for transformation in your life, it is not going to be one session, but is going to be well worth the result, analogous to the example of puberty. In other words, your life will be transformed. And if that's what you're looking for, then this is one place where you can attain that kind of service, receive that kind of service. I'd like to know your comments on this. I'd be interested to know what you think about this. So write down your comments below and ask questions if you have any questions, and I'll be happy to answer them. Thank you.